Hi everyone. So I decided for my project to actually interview my mom, Luann Fogels. She is currently the school nurse at South Anchorage High School, but has extensive career history as a health educator here in Alaska, and she's the reason that I decided to go into this field. So she graduated from nursing school at UAA in 1994 when she was 39 and went on to work for the UAA Health Center as a health educator. So she would work with students coming to the clinic for various health issues, from reproductive health like STDs to minor illnesses like colds and the flu. So what she told me the process would be they would see the doctor, and then if necessary he would then send her in after to educate students on health issues, ensure that they were taking their medications properly, like they understood that they had to take antibiotics for the whole period of time, things like that, answered any questions they had, and then also ensured that proper measures for follow-ups and evaluations were taken. She then went on to work for the Department of Health and Human Services, Municipality of Anchorage, in the Family Planning and Reproductive Health Clinic. She said it was a similar role as her position at UAA, but mainly dealt with issues in reproductive health like birth control, STDs, and high risk behaviors. Um, she said that the main difference between her work with the municipality and UAA was that the fact that at UAA was centered more around a holistic kind of well-being, so she saw more of things like routine illnesses, whereas her work in the municipality was much more centered around um, sexual behavior, and also the patients that she saw at the municipality were mostly low income, low socioeconomic status with limited education and many adverse conditions. Like she said, there was many women that would come from situations of domestic abuse, and she also conducted home visits in which she would visit a particular family periodically, over the course of about 4 to 6 months. She said she gained experience in helping families with their unique needs, and also expressed how learning how to navigate through complex situations while maintaining an appropriate level of support was one of the biggest challenges in her career. She said that this experience visiting homes was extremely beneficial to her throughout her career, and advises anyone with any future goals in public health to gain as much hands-on experience as possible. During her work with the municipality, she was involved in two different health promotion programs. The first was with peer educators, in which she would train students to become peer educators in their community, and provide education on various health topics like reproductive health, STDs, contraceptives, things like that. And she would work with the students to design presentations for middle and high school students, and the peer educators would then go to after school programs at community rec centers, and they would provide pizza and snacks, and they would put on these demonstrations for the students, and engage them in these health promotion or health education. And my mom would sit in the back and kind of serve as just an advisor, just to oversee the whole process. And then she also was involved with RARE T, which initially stood for Reduce AIDS Risk Effectively in Teens, and then was changed to Reduce All Risks Effectively in Teens. And so this she would coordinate retreats for training students in health issues, and then present to middle and high school classrooms. So she's currently the school nurse at South High School. She has been a school nurse for about 19 years now, and has been a school nurse in elementary schools, middle schools. She was the school nurse at Stellar and has been there at South since it opened. She says that her work as a school nurse encompasses all aspects of her work as a health educator, and really gave her all the tools that she needed to be an effective school nurse. She also says that she approaches school health as if it were a community in itself, seeking to promote the well-being of students, staff, and family. She explained that when working with students at an individual level, she would take into account many different factors regarding their cultural background, their family situation, where they were at in school, all in an effort to not only help that individual student, but also the school community as a whole. She also said how different schools different schools in different areas have really unique needs, and what might work for one school would not work for another school. And so she gave the example of, when if you were a school nurse at Bartlett, they might encounter more needs relating to like military families, families who have had one of the parents be sent away or moving or relocating right in the middle of the semester, and that would present their own unique needs. The main health model or framework that she used throughout her career was actually, she said, the nursing process, which is the assessment, diagnosis, outcomes planning, implementation, and evaluation. But she did say that this particular nursing process framework integrates many aspects of different health models, like the trans theoretical model, or stages of change, and the health belief model, and community level theories. She looked over the nursing process with me, and actually we talked about how it related to different health models that we've discussed in this class. And it was really interesting to see how the different models we've learned about kind of pertain to the nursing process, and just how she has used them in general. She talked about assessing the patient's current level of knowledge and readiness to change in order to develop a plan appropriate for their needs. That was in reference to her work as a health educator for UAA and the municipality. So she did refer to experiences when working with young girls in reproductive health, if they have no previous knowledge of birth control methods, then she would have to start there when it came to educating them, or if the specific patient was aware of the importance of contraceptives, but was too timid or scared to actually start using them, then she would tailor her specific intervention to where they are at that moment. And then for the health belief model, we discussed about how an individual's belief about health, perceived benefits, and perceived barriers determine their health behavior. So the patient's reason for seeking clinical help at the municipality or UAA for, let's say, STD treatment or birth control, serves as the stimulus or cue to action that triggers the process of health promoting behavior through the model. So she was explaining how something happened which required them to come see her, and that factored into the whole process. She really emphasized the importance of experience working with individuals from a variety of different backgrounds, and how there really is no one size fits all method to health education. Instead, it's important to integrate many different aspects and concepts learned throughout your education to formulate a plan tailored to the specific needs of. Okay, that concludes my presentation. Here is a list of some links to the organizations she has worked with, as well as her homepage. Thank you very much for listening.